I'm Dr. Michael Allen, author of the books What Your Brain Might Say If It Could Speak and Receptor-Based Solutions, Functional Neurology Every Doctor Should Know. I'm here today to talk to you about a patient instruction handout that I'll give to patients as they're leaving. From my desk, I print out the paper that goes up to the front desk, and then as the patient's standing at the counter before they leave, I'll go over this paper with them. I have their name printed up here and the date that I gave them the papers. And then I'll mark down, for example, I'll put an X 1 inch over and 2 inches up from the belly button and tell them that's for the adrenal glands. And I ask the patient to rub that reflex about the pressure you would over your eyeball for about 20 to 30 seconds, 6 or 8 times a day. So it gives them a reminder of the reflex and where to use it. It also covers things I'd like to do in the office with them, do a nutrition supplement, do it for them to take their nutritional supplements, for them to do a nutrition exam, rub the reflexes here every 30 minutes for 20 to 30 seconds. Do figure eights. This helps the cerebellum on the side that you do the figure eights get more afferentation. And it says right, left, so I'll circle right or I'll circle left if it's appropriate. How to do push-pulls. On the opposite side, push-pulls quiets the cerebellum, so I'll do the opposite side. If I did right figure eights, I'll do left push-pulls. Breathing exercises. Have the person breathe into the count of 4, out to the count of 8, or into the count of 5 and out to the count of 10. And I tell them to do that 3 or 4 cycles every hour. I put a check in the box for that. Use deep blue. It's an essential oil that helps bring heat into an area if they have pain. I might use other topical applications, but I have deep blue in here, so I might put an X in that box. I send them for x-rays, so I'll put an X in there and they can get a reminder to go and get the x-rays. Complete the symptom survey form. I have another symptom survey form that I hand to them, and it tells me different organ systems that I might want to evaluate based on their thinking of how they feel, their symptoms. Over here, an appointment to set up physical therapy. So I would have them set that up at the front desk. An appointment to do rehabilitation therapy, a little bit different than physical therapy. I'll ask them to watch a movie called Understanding Glycemic Index, and I give them the reference on YouTube for that movie. I might have them do optodrum exercises for their eyes. And optodrum is an app you can get on your cell phone. I have to tell them, I circle which way to do it, up, down, right, left, right. Do the struggle bug exercise. We're going to talk about the struggle bug this weekend. I won't get into that now, but it's a simple exercise, but people sometimes need reminders to do those exercises. I'll tell them to use their eye lights or their hemifield goggles. Get a white noise app. You can get that for your cell phone, and then use white noise or other types of noises for the cortical or cerebellar influence that you're looking for. These apps are free. And then take the recommended supplements as directed. This paper goes with the patient as they leave, and I'll keep a copy of it from my records also. And then I will question the patient, are you doing your exercises? Have you set up your nutrition exam? Have you set up your rehabilitation exercises as appropriate? So it's front, back, and sides. Mark it up freely, give it to the patient, and I think you'll see better compliance with your patients and better progress with their treatments. Thank you.